Okay, so once again, warm welcome everyone to our third peer support session for this WHO Scholar Level 2 certification course on comprehensive vaccine preventable disease surveillance. And please feel free to type your city, your city and your country in the chat so we know where you're joining from. And I'm seeing Amaya Jacob that is saying she's not hearing anything in the chat because your audio is not turned on. So let me just leave Amanya a message in the chat to turn on audio to follow instructions on the screen.
You are now clear. Hello, Carlot, I'm getting you now.
Okay, it's because you are not turned on your audio.
Thank
All
you.
right. Okay, so just a quick reminder of the certification requirements because your progress in the course depends on that. So you were supposed to have submitted by yesterday midnight your draft VPD surveillance action plan, and then you have up till Monday to offer constructive feedback to colleagues, and afterwards you'll be expected to revise and improve your action plan based on everything you have learned throughout the course. I'm highlighting these three certification requirements because the first two were already covered, that is attendance and submission of the daily reports. But you still have one report that you'll submit after our last mandatory session, that will be next Tuesday. Now we have congratulations to the 88 people. Congratulations to the 88 people that submitted the initial version of their action plans. So we are actually starting today with session 4 of the course, which has to do with you submitting 3 peer reviews of peers VPD surveillance action plans, and the deadline you're going to see. So the deadline is 11:59 p.m. Monday, 18 July. And there will be no extension. Please take note of this. This is a level 2 course. We have been emphasizing on this from the beginning, that there will be no extensions during this course. So the deadlines are going to be rigorously respected, especially as from peer review. So I would like to encourage you to take advantage of the weekend, do everything that you can to complete the 3 peer reviews. And I'm glad to say, when I checked this morning, some people had already, I think about 3 scholars had already completed 3 peer reviews on peer grade. So peer review, what is it and why is it important? We cannot overemphasize the importance of peer review. We have been saying it from the beginning, we'll continue to say it. Your peers depend on you to go through the course. Remember, the 4th certification requirement for this course is peer review. It means you'll not be able to finish the course if you don't complete 3 peer reviews. Why? Because your feedback is important for your peers to improve upon the quality of their work. And their feedback is important for you to improve upon the quality of your work. And so we believe that the collective intelligence of 3 peers who review your work is sufficient, gives you an average that can help you to improve considerably the work that you have done. And so please, I would like you to have this in mind as you do peer review. And also, it is not just about reading the work of peers and leaving some random comments. The quality of your peer review matters. Consider this. Consider this. The feedback I received left me confused from the peer who gave me the impression that they didn't even read my work, versus I got very insightful feedback that helped me tremendously to improve my work. Thank you for taking the time to review my work. So I am sure all of us will agree that this is the kind of comment we want to get after we have reviewed the work of a peer. So it means that the golden rule for peer review is that you should write in a way you would like to receive feedback yourself. When you're giving a comment to a peer on their work, ask yourself this question: if I was in the position of that peer and I received this comment, would I find it useful? Would I find it helpful? Would I be happy with these comments? So those are the questions you should ask yourself. And above beyond that, you should also ask yourself, have I taken time to carefully read and fully understand the work of the peer? Why have I given a particular rating, but not the others? Have I explained the rating in my comments? What specific and constructive suggestions can I give to help this peer to improve? What professional experiences and insights can I share to help the peer understand better? What resources can be useful to the peer? For example, at the beginning, we have a colleague that said some people is like they didn't really spell out the challenge well. So it can be an opportunity. If this morning I was reviewing some plans and I noticed that there was a scholar that did not use the template, that we provided for the action plan. If you see that kind of a scholar, what do? You can tell the scholar that please, to give your work more structure and better understanding to reviewers, I advise you to use the template that was provided by the course team for the action plan. And you can even paste the link to the Word template. That peer grade gives you the possibility to do so. You can paste the link and say, use this link to download the Word document, the Word template, and use it to write your action plan. That is a feedback that will actually help the peer. So vague statements like, I like the way you wrote this, or this is too short, can you say more? Or that is vague statement like excellent, good job, good work. No, that is not enough. If you are saying that the work is excellent, explain what you found excellent in the work. So it is very important. And remember, this is also capital. Remember, you need to use the rubric. The rubric is the one key document that you need to use for peer review. It's very important. I said in previous session that the rubric is good for you to develop your action plan. It's the guiding document, but it's also the guiding document for peer review. And if you permit, I'll just put up the rubric here on the screen. This is the rubric. And they say rubric for action plan to improve your vaccine-preventable disease surveillance system. And when you go through the rubric, you'll pay attention to the questions and the comments in the yellow boxes. The yellow boxes, you see here, they should say reviewers. So this is addressed to you that is doing peer review. There are a series of questions that will guide you in the feedback and the comments that you give to peers concerning their work. So for each of the sections, you're going to be seeing these questions in the yellow boxes for the reviewers for each of the sections. So please pay attention to this when you're doing peer review. And so that is why even in peer grade, you're going to notice that on the right-hand side, where you see the notation, the rating that you have to give, you will also see this guidance for you. You will also see these questions that are there, the guidance of the rubric, to help you to give peers and colleagues very constructive and useful feedback. So I thought it's important that I come back to this as you are going to be reviewing the work that is done by peers. And so how do you submit a peer review in peer grade? And as I'm doing this presentation, I'm keeping my eyes on the chat. If you have any questions, you can type in your question in the chat or raise your hand, and I'll be delighted to turn towards you to invite you to unmute yourself. If you're having any question or doubts around peer review, feel free to type your questions in the chat or raise your hand, and I'll be delighted to invite you to unmute yourself. So how to submit a peer review in peer grade? The first thing is you will need to log back into peer grade. You need to log back into peer grade, and I'm just putting the link for you here in the chat. And then once you log in, you'll be asked to give feedback. So at times, you're going to be, when you are on peer grade, you'll see it this way. So you have to click on the initial version, because that is what you're working on to give feedback. And then this page is going to appear. But in some cases, you log in and you come directly to this page. And once you're inside the class, you click on the green give feedback button to start peer review. And the next thing you're going to see, and permit me, I'm going to, okay, there's a question from Hanan Khalil. Say, is it mandatory to download our peer action plan, or can we review in peer grade? So Hanan, if your connectivity is good, you can, and you're able to see clearly, you can directly review on peer grade. That is the ideal situation. So you don't need to download. But for people that are maybe in areas where connectivity is a challenge, it may be advisable to download. So this page is not very clear. I may go to, over to peer grade and see if I can just open a peer's work and maybe just show you a demonstration. I'll see. Hanan, I'm going to, if you give me permission to access your page on peer grade. So to access your page on peer grade and for demonstration purposes, show Sorry, I just realized that I have been disconnected, but I'm connecting now from another device. And so as I was saying, if you look on the right side of the screen, and that's on peer grade, so just give me a few seconds. Let me log back on my computer so that I'll be able to share my screen. Meanwhile, I hope, Hanan, you were able to get the answer to the question that you asked concerning downloading downloading the peers action plan. Okay, that's great. I'm seeing your response in the chat right now. Okay, so I'm going to invite you in the room if you want to present your action plan so that you'll get feedback, so that we are going to do a trial at peer review right now. If you want to present your action plan, can you raise your hand or just go ahead and unmute yourself? And if you're able to share your screen, if you're able to share your screen, let us know, even if you're not able to share your screen, but you want to present your action plan so that you can get feedback from peers and also from our subject matter expert, Anna Minta, that's in the room. Go ahead and raise your hand. Go ahead and raise your hand. And I'll be delighted to invite you to unmute yourself. And as I said earlier, if you have any questions or concerns, also raise your hand and we'll be delighted to invite you to unmute yourself so that you can share your question or concern. I hope you're able to hear me.
Yeah, you're loud and clear.
Okay. All right, so as I was saying, is there anyone that wants to volunteer to share their action plan with us today? Please go ahead and unmute yourself or you raise your hand while I am reconnecting on my computer.
Recording in progress.
Okay, so I'm going to share my screen again because I'm back on my computer and continue demonstrating how to carry out a peer review on peer grade. And now I'm sure I'm able to access peer grade again. So, okay. All right, so I'm going to go to access, like I said earlier, Hanan's here is peer grade. So once you are on peer grade, you'll be asked to give feedback for the initial version of the VPD surveillance action plan. So you click on give feedback. So once you click on give feedback, you're going to see on the first thing you'll see is submission 1. So you'll see that you have received three submissions. That's the work of 3 peers to review. And this is it. But it's only submission 1 that is open. Submission 2 and 3 are locked. So it's only when you have submitted feedback for submission 1 that submission 2 will automatically open, and it's only when you have submitted feedback for submission 2 that submission 3 will automatically open. And then now you have here on the left hand side the submission, the action plan of the peer. That is it, and you can actually read it. You take the time to go through the action plan, and on your right hand side this is actually the rubric that we have just taken, and we have put it here on peer grade to guide you for peer review. So the first question that you're asked is, what is the author's current level of work for VPD surveillance challenge? And as a reviewer, you should explain your rating and give concrete and specific suggestions as to how the author can improve. And so if you scroll down, I see, okay, Hanan, you have already started the peer review. That is great. So you scroll down. Once you give a notation, for example, an important challenge in VPD surveillance is identified, only requiring minor, and then you explain why you gave that rating. Okay, so that is it. And you can see here you can see here that Hanan has taken the time to actually give a detailed feedback to the peer. Samuel Gia, I see you're unmuted. Okay, you've muted yourself. So and so if you scroll right down, you're seeing for each of the sections there is the question that will guide you during peer review. You have the rubric, it is here, so you don't need the rubric to be open in front of you. It's all here in peer grade. And so that is why Hanan was asking that whether we needed to whether she needed to download the document. So if you're having connectivity issues, you may download the peer's work so that you can actually read it offline, and then but you will need to log back into peer grade in order to give your feedback. So once you have given the feedback, you go right down to the end. It is only then that you can submit the feedback. And when you are sure, you see, so you can also look at the average rating, and peer grades congratulate you when you have made effort in that regard. So that is very important, and I wanted to demonstrate this to you here so that you'll see what the peer review process is all about, and what it takes to carry out peer review. So that said, I think we have taken enough time to demonstrate this. So I'd like to turn now towards you who is in the room. If you want to present your action plan, you want to present your VPD surveillance action plan so that you will receive right here feedback from peers and from our subject matter experts. So go ahead and raise your hand, or just simply unmute yourself so that you can share your action plan. If you're able to share your screen, that is great. But even if you're not able to share your screen, I can do the screen sharing for you. I can access peer grade and put up your action plan. So especially if you have not been able to present, you didn't present yesterday or the day before, and I'm encouraging those who have never spoken in any of our sessions, if you're able to do so, please just go ahead, raise your hand. And if you are not from Nigeria, because yesterday we actually got, I'm sure, 2 action plans that were presented from Nigeria, I also greatly encourage you to go ahead and unmute yourself or raise your hand. And as I said earlier, if you have any questions or any concerns around peer review, this is also the opportunity for you to ask your questions or your concerns. You can unmute yourself to do so, or you can type your questions in the chat.
Hello, Charlotte. I'm Jacob from South Sudan.
Okay, hi, Jacob.
Actually, I have already finished my peer review. Yes,
Okay.
I have already finished reviewing of my 3 peer grade review. Unfortunately, I'm using the phone. I would have loved to present my action plan for PPDR, but because it is
The
the
good
phone,
news
so I'm
is,
unable to present. But
no,
otherwise, so far, so good on my
Amanya,
side. And
Amanya,
yeah,
sorry for interrupting you, but the good news is I can
yes,
actually share the screen for you. And since you say you have completed peer review, are you able to share with us one of the
yes,
works that you reviewed? So I'm going to share the screen for you, and then you can just briefly summarize one of the
okay,
works that you actually peer reviewed and the comments that you gave the peer. Is that okay?
all right, okay. Then I'll be
Okay,
waiting.
so
I would love to see
let
that.
yeah, so let me access your page on Peer Gray, and we'll go to here. We'll go to
Okay,
review. Okay, I'm sure you're able to see my screen.
yes,
Okay, so which of the
yes.
works do you want to comment on? Should I portray submission 1, submission 2, or submission 3?
Yeah, any of this, I think is okay.
Okay, so I should leave this one: improve disease detection,
Uh,
reporting, and timely release of funds in for VPD in Kano.
Here, the first, let me say something on this. On this
Yes.
title, improving disease detection, reporting, and timely release of funds for VPD. To me, I have given here a comment that the author should only concentrate for improving disease detection and reporting of disease surveillance of the VPD. So that's the comment I give. The author is should be more specific to the vaccine preventable diseases challenge, and the title rephrase well. This is more actionable. But my question is that issue of little bit concern.
So, Amanya, what I'll request that you do is just, can you just summarize the whole action plan, and then afterwards you tell us now the feedback that you gave to the peer. Is that okay? And I can help to scroll
Okay.
down for you.
Yeah. Okay. Let us start from the first. Yes. This is the first one. I said I recommended here an important challenge in vaccine preventable disease surveillance is clearly and constantly explained. Here, I said the author is more specific to the vaccine preventable disease surveillance challenges, and the title rephrase well. This is more actionable than saying, yeah, this is okay. We go to the next.
So, what about the VPD surveillance context?
Move yeah, the context is well captured. I have no problem with that. It is clear. Let us just move down. Let's go to the action plan.
Okay. So, but please, can you read you took the time to read the context. I want peers in the room to understand maybe a little bit what the context is for this person, so that when they look at the actions and we look at your feedback, we'll be able to align the two. So maybe, yeah.
Let us start with the workforce. Okay. We can start with the author workforce. The surveillance structure for the vaccine preventable diseases start from the community to the health facility. This is exactly, at the workforce, surveillance structure, of course, it started from the health facility, then it comes to the higher levels of the referral systems. This is well captured to me. That's why I'm saying this on the workforce, the author has explained to their local context in Nigeria, because this person, the author, is from Nigeria. He has explained the local context of the workforce of his VPD surveillance context, which is very clear. On the laboratory aspect, The state has a public health laboratory, scientist who is in charge of the all vaccine preventable samples collection and transportation. The samples collected depend on the vaccine preventable disease, which are being shipped to various. This is also clearly explained. That means in the Ottawa is telling us that within their country context, the laboratory system is more robust, is more developed, that the system for data could well articulated. So here I have no problem. When you look at the information system for vaccine preventable diseases, is based on the integrated disease surveillance. Follows the work structure that each facility their focal person for integrated disease surveillance. So here, the flow of the information of this of the VPD diseases really comes from the health system. So here, the flow of information is defined. Yeah, and in at the same time in Nigeria, I think they have done some applied research which is already conducted in the country, which is also well defined. To some countries, I have no problem with that. Which that's what I have said. The vaccine preventable disease context start from the workforce, which is a well articulated job done. Looking at sustainable finance, here, of course, one of the major challenge of vaccine preventable disease surveillance is non-release of funds. So here I disagree with the CHOA. I begin saying no, he has to improve a little bit. I said it is good, but he requires some minor improvement. The improvement is that he has to be more specific because when you say you want to improve early detection of vaccine preventable diseases and timely release of funds, here the funds are not majorly coming from the government. You know, the integrated disease surveillance and response across many countries is being funded by the donors, the WHO, the UNICEF, and Gavi. Some of those, a few ones I mentioned. So here, you cannot tell when will these funds be reimbursed. So here a little bit, I said, you better be specific by saying, rather you look at the government allocation, advocate for the government to allocate a physical budget for vaccine preventable disease. So this is what I get. Then my goal, let us look at the goal. I think the goal I've already explained.
You mentioned screening patients within our surveillance criteria.
Hello?
Yes, Amanya, your voice is breaking a little bit, but please, can you go ahead? I think we can hear you.
Yeah, I think we are now at the last point. Let us look at the action plan. I mean, the action, how do you call it, the concrete actions to achieve the goals. Here, the author also articulates very clearly. He has defined this action plan, although we are supposed to look at a specific challenge and break down the action point to the state of being where they can be achieved. So here, this author clearly defined this in short, medium, and long term. So in his short term, he wanted to increase the number of community informants at the community level. Of course, to him, he can improve the early case detection and reporting, because by deploying this community, by identifying or increasing the number of community informants, they will be able to report cases of vaccine preventable diseases in the community. And this action can be achieved, is achievable. So here I rated him that he has done a good work. I have no problem with that. So all his action plan are actionable to me. So okay, here what I have written, the the areas of plan activities are broken into real actionable approaches and models and tasks. So here, it is excellent work for me.
Okay, thank you so much. Okay, thank you so much, Amanya. And then there is the aspect of overall credibility and feasibility of the action plan. I also saw, okay, you gave excellent credibility and feasibility. All right, so peers, participants in the room, you will have seen this action plan and the review that was given by Amanya Jacob to the work of this peer from Kano in Nigeria. What are your thoughts? Any comments, any questions for Amanya around this, around the peer review? If you were reviewing this particular work, is there anything you want to add to the comments given by our colleague Amanya to this peer? So you can, you know the drill already, you can use the chat to type your comments, or you can simply unmute yourself to speak. So while you are thinking about that, I would like to turn towards our guide on the side, Anna Minta. Anna, when you look at the challenge that is highlighted by this scholar and the context that is spelled out, and thinking about the comprehensive VPD surveillance guideline in line with the IA 2030 core principles, is there something that could be added to this particular action plan and also to the peer review? Anna, are you able to unmute?
Yes, okay. I'm here. Thank you, Charlotte, and thank you, Amanya, for sharing the action plan that you reviewed. I think it's very good, as you did, to go through in detail and review what has been written and provide specific feedback. I will say that the challenge is important, as you indicated, because all cases from the global strategy, all cases should be detected in a timely manner and reported immediately or within a specified time frame for each VPD, so that action can be taken from the immunization program and the surveillance staff. So, so the challenge is in line with the strategy. I noticed that the first 1 or 2 action plan items were about community health workers. Yeah, the first one is about community health workers, and the second one was supportive supervision. So for the first one, yes, including the community and surveillance is a key part of the strategy. It's part of having community ownership, and then that goes up to national level ownership. So that is also in line. And I think for some additional feedback that could be given to the author of this, which they've done a very good job, very thorough and good action plan, is to perhaps in the challenge, they can specify what specific issues they think are causing the late detection. Because when you come to the action plan, I'm guessing they're concerned about not having enough community informants and not having adequate workforce capacity, because they mentioned supportive supervision. So those are what could add some specificity to the challenge that they mentioned here, because I didn't see community health workers not being involved or a lack of workforce capacity listed there. So that's some additional feedback that you can give. The information, in this case, the information is there. It's just that the author could clarify, so the reader can kind of see where they're going from the beginning. So those are some additional feedbacks I would give. But you've done a very good job with your feedback, and I think it's a good example for us, especially reading in great detail what your colleagues have written.
Okay, thank you so much, Anna. I just wanted to ask you one quick question, because if there's a problem of late detection and all of that, is there a way that the author could use data to actually back up the importance of their challenge? And what kind of data could be useful in this context?
Oh, thank you. That's a great question. Yes, and that's a good point. And India had mentioned that before, I think earlier this week, but not everyone may have been there. So yes, to highlight that, because we're all in surveillance and immunization, we know the importance and the power of data. So when you are doing your action plan, it would give more weight for your plan, and when you're approaching the government, to have some data. For example, you could, this author could have said, you know, in last year, only 60% of cases were reported within the recommended time frame for our country, or 40% or whatever it was. Then you have a concrete number based on your data that you can show, and that shows some additional effort on your part to find that data, and also gives the reader and whoever you're going to advocate to, usually the government, exact numbers, which is very helpful. And then you can tell them your personal experience based on the context, that you know part of the delay is because the community health workers are not involved in cases. So it takes too long for the health facility to be aware. So if the community health workers could be engaged in case detection, then you're quite sure that this would increase the number of reports that were made in a timely manner. So that's an example of some data that you could provide. Thank you.
Okay, thank you so much, Anna. And Amanya, I just wanted to say, after listening to these comments and feedback from Anna, there is a possibility for you to actually go back and improve upon the peer review if you think that there are some pertinent things that have been highlighted and that you want to add to help this peer improve upon their work. So you still have the possibility. You just need to go back to peer grade, and then you type into the additional comment spaces. You add the information you want to add, and then you can still, all you need to do is to save feedback. So once you do that, you click on save feedback, you can actually go ahead and add more information to your peer review. So as long as the deadline is not passed, there is still a possibility for you to improve or to add more comments or more feedback that can help the peer to actually improve upon their work. So Amanya, I don't know if you were able to get all of that. Amanya?
Yes, I think that's clear. I will get time, especially for the weekend, and do that edit. Added a few comments that were suggested by Anna and you. I will try to do that and edit. However, I'm sure the rest of the first two reviews, I think I exhausted one properly. I gave a lot of guidance. It's okay. The point well taken.
Okay, that's great. Thank you so much, Amanya, for volunteering to be the first person to share a word, considering that peer review was just opened at midnight Geneva time, and that you have already been able to go through and complete and present today. So we thank you for that. I don't know if there's any other person that will want to. You have seen the process. There are two options. Either you want to present your own action plan because you have not yet started peer review, or you have peer reviewed an action plan and you want to present that. Please feel free. And even if you're not able to share your screen, as you have already noticed, we can do the screen sharing for you. So any other volunteer? If not, we are not obliged to go up to the 60-minute mark for this session. If there are no other particular concerns, I'll just do a quick reminder, or recall of what is expected of us, keeping in mind that the deadline for peer review is 11:59 p.m. Geneva time, Monday, the 18th of July. And as I said earlier on, there is no extension. No extension is going to be allowed because this is a level 2 course. But as you do peer review, keep the golden rule for peer review in mind, that you write as you would like to receive the feedback yourself. Okay, I see Dr. Mohammed Bonus. Dr. Mohammed, go ahead and unmute yourself.
Yes, good morning, Charlotte, and good morning, good afternoon, good evening to all the colleagues. Charlotte, I was just wondering, you've done very well with the coaching, with the guidance, with everything. I was just wondering if this rubric on the review panel, if this should have been shared before people submitted their plans. But I thought the rubric would have guided people much more better when they are developing their plans. As I'm looking at the rubric, I saw how, in retrospect, how people should have done with ease and things like that. The rubric had come earlier before we submit. I think it would have gone a long way. Thank you.
Thank you, Mohammed. But just to say, if you can see my screen, you're actually seeing the rubric that is on peer grade is exactly the same PDF document that was shared when you were accepted for the course. It was shared throughout the week. It was shared even up till yesterday. So it is the same rubric. We just carried what is in this document that I'm sharing in the screen right now, and we put it for you on peer grade.
Really?
Is that okay? Yes, so it's just the same thing verbatim. So like if you see even the grading, you see current level of work, that is to help you to even do your own self-evaluation and peer review. The grading that you're giving to peer, it was already there on the document. And I see Hanan was saying in the chat that it was shared at the beginning of the session and even before we started the course.
All right, that's well taken. Thank you very much.
Okay. So there is Essa Jama. Essa, your hand is raised. Go ahead and unmute yourself. Kabir Yusuf, my screen is shared. If you're not seeing my screen, then probably you have connectivity issues. Essa, over to you.
Okay, good morning, good evening, good afternoon, Charlotte and the team. Thank you. Yesterday, I was, when the peer review started at midnight, I was awake and I tried to start someone from Nepal, and I will finalize the first one by the end of the day. So how can I continue session? That was session 1. So the requirement is to do 3 reviews. I can extend more than 3, or I still continue only for 3 reviews per as written.
Oh, so Essa, you have been assigned 3 reviews. And so if you're assigned 3 reviews, yes, just focus on doing those 3. Is that okay?
Excellent. We'll copy.
Okay. And so do you have any other concern?
No, thank you.
Okay. All right. So if there is no other question or concern, I'm going to highlight this again. And probably if you missed the rubric, probably share the rubric again in the chat so that you will be able to use it. But as I said, the rubric, it is on on peer grade. It's on the right hand panel on peer grade, where all the guidance is that will help you to carry out constructive and useful peer review. But I'm sharing the PDF document again with you on the chat. And if you joined late, maybe like I said also, as you do peer review, there's something you need to pay attention to. That is what is written. That is questions that are specially set for reviewers. Is the goal that is so for each section, you'll see a special mention reviewers in the yellow boxes that want, when you are doing peer review, pay attention to these questions because they will help you to give constructive feedback that will help the peer to improve upon the quality of their work. And also keep in mind all of the comments that have been shared throughout this week by our subject matter experts. Yesterday, during yesterday's session with Anilia and Anna, there were some very important highlights that they shared with us that you should keep in mind, even as you work on your action plan, as you implement your action plan, or as you carry out peer review. So that is important to analyze and look at the different funding opportunities, the donors available in your context. If you're thinking about sustainable financing, always have integration in mind. Present your operational data, and Anna came back to that. And then what are the gaps as far as the key indicators are concerned, because that is what you can use to get your donors to respond, or your government to respond to your needs. And then try to have the government on your side. Think about building collaborative teams, and your plan should depend on your level. If you are subnational, your plan should be more operational. If you are the national level, you think about the policies and the strategies for national levels. All right, so if there are no more questions, no more concerns, I think we are going to end it 15 minutes earlier with today's peer support session. But please do remember the deadline. Remember the deadline, and my advice for you, my suggestion for you is take advantage of the weekend. So peer grade will be open over the weekend.
Charlotte and Anna, maybe before we break, Charlotte and Anna, maybe, before maybe you close up. This is to you and Anna. I just wanted a guidance on this. One thing.
Please go ahead, Amanya.
As per the few peer review, yes, I need your guidance, and Anna, as per the few peer review that I look at, when you look at my challenge, some of the scholars went to the extent of mentioning more than 5 challenges. As such, when you continue following and reviewing, that gives us a lot of work as reviewers. I want to know from you, because the title say my challenge, my vaccine-preventable challenge. So shall we continue guiding these people to remove the rest of the challenge and concentrate to one? That means they have to revise completely, including their actionable plan. What do you advise on this? What do you guide on that?
So I'd like to turn towards Anna.
Yes, that's a very good question. I would say that in the rubric, it says to specify one challenge that is very actionable. And I think that in the context part, there's an opportunity to list all the other challenges, because we know there are so many challenges, and also that each challenge is probably interrelated with some of the other ones. So you may have one main challenge, but there are maybe your challenge is workforce, but part of that problem is funding. Part of the problem is with the lab, for example. So I think it would be best to clarify one challenge that you're really trying to address. But for the action plan, you can have several challenges that are interrelated, like I said. So if your primary challenge is like the one we looked at, there was a delay in cases being reported, the action could be related to workforce and funding and maybe lab or something. So there could be actions that are related to different objectives within the strategic plan. So that's what I think. And I'm interested also in Charlotte, if you think that's agreeable for the way the rubric is outlined.
Yes, Anna, that's exactly the way the rubric is outlined. You say, and I'm just sharing the rubric on the screen because it's like our compass in developing our action plan. So my VPD surveillance challenge is provide a clear and concise description of the most important challenge you face in your work on VPD surveillance. And we go ahead to give more details as to what should shine through in the description of your challenge and why it is important to you. So, and to you who is reviewing, what are you asked to do? So you say, is the challenge identified by the author related to one of the 5 aspects of VPD surveillance? So if you're reviewing and like Anna said, when we go now to the context, you may, and remember a lot of you did that, is you describe your context, and some people actually went ahead to do a SWOT analysis. And you know, when you do a SWOT analysis, the strengths and the weaknesses, you will probably highlight many more other challenges. But all of those should, at the end of the day, it is your priority challenge that you'll be focusing on. And the actions that you're spelling out could could cut across all of the different aspects of VPD surveillance, of the VPD surveillance system, that's workforce laboratory information system, applied research, and could respond to other minor challenges that you may have, but together help you to solve your priority challenge. So as a reviewer, what will you be telling the author of the work that you're reviewing? Is there a priority challenge that is highlighted? That is the most important thing. So if the author has too many challenges, you may want to ask the author to prioritize, because that is what the guiding document tells us. So Amanya, I don't know if that answers your question and your concern. Amanya? So as I said, I'll just constantly and continuously be referring you to the rubric, because that is really what should guide you as you do peer review, but also keeping in mind your personal experience, what is happening in your context, because the situation in your context, that is why the whole focus during the first and the second sessions with the group works, each methodology was about experience sharing, you being able to share with your peer what you are doing to solve a particular challenge they are facing in your own context. So your experience at times can actually help the peer to orientate them in the actions that they are taking to solve the challenge. All right, so thanks again. Thanks, Amanya, for asking that very relevant and important question, because I am sure it has not only helped you, but it has also helped other peers in the room who have engaged and are going to engage in peer review. So if there is no other question, no other comments, no other concern, I'd like to thank you all once again for participating today. And I look forward to our peer support session on Monday. So it's going to be our last peer support session. And it's at the same time, 11 a.m. Geneva time. It's the same Zoom room, the same Zoom account as today. So it's going to be our last peer support session. And that one will be going to be focused exclusively on peer review. So you'll be coming to share how you have carried out peer review of colleagues' works. So wish you a great weekend of peer review, and look forward to seeing you on Monday. And once again, thank you, Anna, for being there to guide scholars as they do peer review. And look forward to seeing you next Monday. And bye for now. And please do not forget the deadline. Don't forget the deadline.
Bye-bye. Bye-bye. Thank you. Bye.
Thank you, too.
Thank you. Bye-bye.
Bye-bye.